Picture this. It's a Saturday morning, spring. You've got nowhere to be. You grab a cup of coffee, pull on an old flannel shirt, and head out to the garage, or maybe the shed out back, the one you haven't touched since October. You figure today's the day you finally tackle it. Clean it out. Get organized. You drag open the door. That smell hits you. Musty, old, a little like wet cardboard. You don't think much of it. You grab a broom and you start sweeping. Dust rises. Cobwebs come down, and tucked in the corner near the old camping gear, you notice it. Little dark pellets. A nest made out of shredded insulation. Rodent droppings. You think, gross 'em, and keep sweeping. 2 weeks later, you're in a hospital bed. You can't breathe. A machine is doing it for you, and the doctors are telling your family that your lungs are filling with fluid, and they're not sure there's anything they can do. That is not a hypothetical. That is how Hantavirus kills people. And it happens more often than anyone is talking about. Stay with me, because what I'm about to share could genuinely save your life or someone you love. And most of it, most Americans have absolutely no idea about. Let me introduce you to a guy named Larry, late 60s, retired electrician, lives in rural New Mexico. Spent 35 years working with his hands. Smart guy, healthy guy, the kind of man who'd never taken a sick day in his life. One spring, he decides to open up his hunting cabin for the first time since November. The place had been closed up all winter, sealed tight. He noticed some droppings inside, figured mice had gotten in through a crack somewhere. He grabbed a broom, swept it all out, aired the place, and got on with his weekend. A week and a half later, fever, muscle aches. He figured it was the flu. His daughter begged him to go to urgent care. He waved her off. He'd had the flu before. He knew what flu felt like. By day 4, he could barely stand up. His wife drove him to the emergency room. By day 5, he was on a ventilator. Larry didn't make it. And here's the thing that keeps public health workers up at night. Larry did everything that millions of Americans do every single year. He opened a cabin that had been closed. He cleaned up some mouse droppings. He didn't think twice about it, because nobody told him. Hantavirus pulmonary syndrome, that's what the pathogen causes in the United States, specifically carried by the deer mouse, is not something most doctors in city hospitals think about quickly. It's not something your neighbor warns you about. It is quietly, methodically lurking in exactly the spaces where older Americans love to spend time. Cabins, barns, garages, storage sheds, campers, old farmhouses. Here's the first hidden truth most people don't know. You don't have to touch a mouse. You don't even have to see one. The virus lives in rodent urine, droppings, and saliva. When those materials dry out, and they do over weeks and months in a closed space, they become dust. And when you walk in and start disturbing things, sweeping, vacuuming, moving old boxes, you breathe in that dust. That's it. That's the whole exposure. One breath. In a space where a mouse lived months ago. I need you to really sit with that for a second, because this isn't like touching a contaminated surface and then touching your face. This is just air. In a place that looks perfectly normal, in a place you've been 100 times. How many of you have opened a storage unit lately? Cleaned out a parent's basement? Gone into an old barn? That's why we're talking about this today. There's a woman I want to tell you about. We'll call her Diane. She was 58, a retired school librarian, lived in Arizona. Active, healthy, took care of herself. She and her husband had just spent a long weekend helping their son clean out his property. Old horse stables that hadn't been used in years. She felt fine the whole trip. Drove home Sunday night. Monday, she had some body aches. Tuesday, a low-grade fever. Wednesday, she started feeling short of breath when she walked up the stairs. By Thursday night, she couldn't take a full breath lying down. She called her doctor Friday morning. He diagnosed her, over the phone, with a possible respiratory infection, prescribed antibiotics, told her to rest. By Friday evening, her husband called 911. She was intubated within hours of arriving at the hospital. The problem with hantavirus, and this is the second hidden truth, is that its early symptoms are almost perfectly designed to be dismissed. Fever, muscle aches, fatigue, headache, nausea. Tell me something. What does that sound like to you? To most people, it sounds like the flu. Maybe a bad cold, maybe COVID. And when you're 55 or 60 and you've been through a lot of winters and you felt flu before, you figure you know what this is. But here's where hantavirus deviates from everything else in a way that is genuinely terrifying. There is a window, typically between day 4 and day 8, where things can fall apart fast. Medical professionals call it the cardiopulmonary phase. Your lungs begin filling with fluid. Your oxygen levels drop. Your heart can go into shock. And what makes this so dangerous is that the deterioration isn't gradual. People describe it as going from feeling lousy to can't breathe in a matter of hours. Dr. Christina Spiropoulou, a researcher at the CDC who has studied hantaviruses extensively, has described the progression as explosive. The lungs can go from looking normal on a chest x-ray to being essentially flooded in 24 hours. There is no specific antiviral medication approved to treat hantavirus. Doctors support the patient, oxygen, ventilators, IV fluids, and they wait, and they pray. The mortality rate of hantavirus pulmonary syndrome in the United States sits at approximately 36%. Let that number breathe for a second. 1 in 3 people who develop HPS die. That's not a third world statistic. That's in American hospitals, with modern ICU care, with ventilators and specialists. And most of the patients who walk through those ER doors don't even know they were ever exposed to anything. If you're watching this and you're over 50, I need you to turn the volume up just a little, because this next part is specifically about you. Here's something that doesn't get talked about enough. The populations most frequently affected by hantavirus in the United States are not children. They're not young adults in cities. They are predominantly adults between 40 and 70 living in or visiting rural or semi-rural areas. Farmers, retirees, campers, cabin owners, people who spend time outdoors, who work with their hands, who have properties with old structures on them. And there's a reason older adults face worse outcomes. By the time you're in your 50s and 60s, your cardiovascular and pulmonary reserves, the extra capacity your heart and lungs have to handle stress, are already reduced. You may not notice it in daily life, but when a virus launches a systemic attack on your respiratory system, that reserve matters enormously. Meet Richard and Carol, retired couple from Colorado. They bought a mountain property, an old farmstead, as their retirement dream. Every summer, they'd drive up, spend 2 weeks, get the place ready. They loved it. One summer, Carol noticed more rodent activity than usual. They'd had a wet spring. The deer mouse population had exploded. She figured she'd air the place out, clean up, get it squared away. She was a practical woman. She'd dealt with mice before. Richard started feeling sick about 10 days later. He figured he'd just overdone it with the work. He was 67 after all. Some aches, some tiredness. Nothing alarming. Carol made him soup. They watched television. They went to bed. In the middle of the night, Richard woke up struggling to breathe. He spent 11 days in the ICU. He survived, but just barely. And he told a local reporter afterward, "I didn't even think I'd been sick. And suddenly I almost didn't exist anymore." Here's the third hidden truth. Deer mice populations explode in years following wet winters. When there's more vegetation, there's more food for rodents. More rodents means more virus. And public health officials track these population cycles, but that information almost never reaches the people it would help most. The people who own rural properties, who open cabins in the spring, who go camping after a particularly wet year. Right now, deer mouse populations in many parts of the American Southwest and Pacific Northwest are elevated. This is not hypothetical risk. This is a live, seasonal, active threat. And here's what older adults specifically need to hear. If you feel flu-like symptoms in the days or weeks after any potential rodent exposure, you need to tell your doctor explicitly those exact words. "I may have been exposed to rodent droppings." Because if you don't say it, there's a reasonable chance your doctor, especially in an urban or suburban setting, won't put it together until it's too late. This one right here is the one that I think about the most, because it's not about ignorance of the disease. It's about something so reflexively human that almost everyone does it. You find droppings, you grab a broom. That instinct, that completely rational, reasonable, clean your house instinct, is one of the most dangerous things you can do in a space contaminated with hantavirus. Let me paint the picture. Janet is 62, lives outside of Sacramento. Her adult kids are coming to visit. She goes into the garage to find the extra folding chairs. She sees mouse droppings along the baseboard. She doesn't want her grandkids to see that. She grabs the broom, does a quick sweep, throws the droppings in the trash, gives the area a wipe. The whole thing takes 5 minutes. In those 5 minutes, she aerosolized contaminated fecal matter, turning what was sitting safely on a hard floor into tiny particles suspended in the air she was breathing. 3 days before her kids arrive, Janet is feverish and exhausted. She figures she's coming down with something. She tells her daughter over the phone, "Don't worry, I'll be better by the time you get here." She was not better by the time they got there. The fourth hidden truth is this. Sweeping and vacuuming in a rodent-contaminated area without proper protection is a primary mechanism of hantavirus transmission. It's not just dangerous, it's the exact scenario that accounts for a significant portion of exposures documented by the CDC. So what do you actually do? You do not sweep. You do not vacuum without a HEPA filter. You do not go in dry. The correct method, and this is what the CDC actually recommends, is to ventilate the space first. Open windows and doors. Let fresh air circulate for at least 30 minutes before you go in. Wear rubber or plastic gloves. Wear an N95 respirator, not a surgical mask, an N95. Mix a disinfecting solution, 1 cup of household bleach per 10 cups of water. Spray the droppings in any contaminated area thoroughly and let it soak for 5 minutes. Then, and only then, wipe it up with paper towels. Double bag everything. Wash your hands and change your clothes afterward. That sounds like a lot, I know. But you know what sounds like a lot more? 11 days on a ventilator. The extra 10 minutes it takes to do this correctly is the difference between a mildly annoying spring cleaning project and a near-death experience. We talk about cabins. We talk about barns. We talk about garages. And yes, those are absolutely high-risk environments. But here's where it gets uncomfortable. Because Hantavirus doesn't read a map and stay in rural Montana. The deer mouse, the primary carrier in the United States, lives in 49 of the 50 states. It lives in suburban neighborhoods. It lives in city parks. It lives in RV storage lots, in vacation storage units, in the crawl space under your house. Tom and Eileen are a couple in their early 60s from suburban Ohio. They bought an RV 6 years ago. Dream retirement, see the country. They kept it in a storage facility between trips. One spring, they pulled it out, opened it up, were delighted to find it was in great shape. They noticed a small nest in one of the cabinets. Figured it must have gotten in through a vent at the storage lot. Tom pulled the nest out with his bare hands and threw it away. Eileen wiped down the cabinet with a damp cloth. 2 weeks later, both of them were ill. Tom recovered. Eileen was hospitalized. The fifth hidden truth: enclosed spaces that are used intermittently and sealed between uses are extremely high-risk environments. RVs, camper trailers, storage units, hunting blinds, ice fishing huts, even rarely used rooms in your own home, like a basement guest room you only open up a few times a year. Any space where a rodent could have been living and no one would have noticed is a space where you should treat the air with the same respect you'd treat any potential hazard. And here's something that cuts even deeper. The 1993 Four Corners outbreak, the one that put hantavirus on the map in America, killed young, healthy Navajo adults in their 20s and 30s. Some died within days of their first symptoms. One of the victims was a 20-year-old athlete who collapsed and died before he even made it to the hospital. This virus does not discriminate, but it is particularly brutal with older adults, people with underlying heart or lung conditions, and anyone who doesn't realize they've been exposed. During the COVID pandemic, there was a phrase that got used a lot: novel virus with no treatment and no cure. That framing created, rightfully, enormous public urgency. Here's what doesn't get said enough. Hantavirus, at its worst, carries a higher mortality rate than COVID ever did in most patient populations. COVID's overall case fatality rate across all ages and all variants averaged somewhere between 1% and 2% globally over the course of the pandemic, depending on the variant and the population. For vaccinated, healthy adults under 70, it was often a fraction of a percent. Hantavirus pulmonary syndrome kills about 1 in 3 people who develop it. Full stop. Now, the important distinction. Hantavirus does not spread person to person. You cannot catch it from someone who has it. It is not a pandemic-level threat in terms of transmission dynamics. COVID spread from breath to breath and infected hundreds of millions. But if we're talking about what happens to an individual who contracts this disease, the comparison is not flattering to our collective level of awareness. This is the sixth hidden truth. The mortality rate of hantavirus pulmonary syndrome exceeds almost every respiratory illness Americans are typically warned about, and yet it receives almost no public education, no annual PSA campaigns, no mainstream health initiative aimed at the populations most at risk. Dr. Jay Bhattacharya and various public health voices over the years have noted the disparity in how we communicate risk to the public. We spend enormous resources educating people about Lyme disease, about heart disease, about stroke, all of which are absolutely important. But a disease with a 36% mortality rate that is preventable through simple behavior change? It sits in near silence. There's a family in Tennessee, a daughter whose father died of HPS 3 summers ago, who has been quietly advocating in local media for more public awareness. Her name is Michelle. She told one reporter, "My dad was in that shed for maybe 20 minutes. 20 minutes. And he was dead in 2 weeks. And the worst part was, neither of us had ever even heard the word hantavirus." That stays with me. It should stay with all of us. I want to end this not with fear, but with something actionable. Because the whole point of talking about something this serious is not to scare you. It's to hand you something you can use. So let's talk about what you actually do. If you're a homeowner, cabin owner, farmer, RV enthusiast, camper, or really anyone who spends time around older or occasionally used structures, here's what changes from today forward. Before you enter any space that's been closed up, open it from the outside first. Don't go rushing in, let it ventilate for at least 30 minutes. If it's a small structure, longer. Fresh air moving through breaks down the concentration of any aerosolized particles. It's simple. It costs nothing. Do it every time. If you see signs of rodent activity, stop. Don't sweep. Don't disturb anything. Put on an N95 and gloves before you touch anything. Wet it down with your bleach solution before you move it. Know the warning signs. Fever plus muscle aches plus fatigue in the week or two following any potential rodent exposure is a medical emergency until proven otherwise. You go to the ER. You say the words out loud, "I may have been exposed to rodent droppings." Write it on a piece of paper if you have to. Make sure the doctor hears it. For RV and cabin owners specifically, before you use your vehicle or property after extended storage, inspect it for evidence of rodent activity. Look for droppings, nests, gnaw marks, chewed insulation. If you find any, treat the cleanup as a hazmat situation, because medically, that's what it is. Seal your structures, steel wool packed into any gap larger than a dime. Hardware cloth over vents, rodent-proof food storage. These are not difficult measures. They are the difference between a mouse that lives in your shed and one that doesn't. There's a retired couple in Oregon, spent their whole careers working toward a little farmstead outside of Bend. They watched a documentary about Hantavirus 2 years ago, spent a weekend sealing up every gap in their barn, put metal mesh over every vent, got in the habit of ventilating before entering. They've never had a case. They also have the kind of peace of mind that money can't buy. Hantavirus is real. It's in your state. It's in your neighborhood. It's in that shed you haven't opened since last fall. It kills roughly 1 in 3 people it infects, and it does it through some of the most ordinary moments of everyday life. But it is also, and this is the critical part, highly preventable. Ventilate. Wear your N95, wet before you sweep. Know the symptoms. Use the words. The people who died from this, and thousands of Americans have, didn't have less common sense than you. They just didn't have this information. Now you do. Share this video. Seriously. Think about the people in your life who own a cabin, who camp, who have a barn, who just bought a rural property. Think about your parents, your siblings, your neighbors. Send it to them. Because the difference between a story that ends in a hospital and one that ends on a porch watching a sunset is sometimes just knowing what to look out for. Stay safe. Take care of each other.